is a local organization in Lebanon, and we have been active more than 20 years in the field of working with marginalized communities in Lebanon, actually. Regarding the DOM topic, what I want to present today is mainly findings of a research that we have done, that Insan has conducted together with Terre des Hommes. And we have found very interesting findings from this research. So I'm going to start now to present, which gives like a good idea about the DOM in Lebanon, their situation and their historical, like also like a bit of their existence in Lebanon. So the DOM in Lebanon are far from a homogeneous group. The geographical characteristics of a given DOM community seem to influence social relations between DOM and other groups. At the same time, our research revealed that geography can also impact the levels of social cohesion within the DOM. The conventional model of social organization amongst the DOM is family-based and tribal, whereby the family constituted the primary social unit and several families could belong to a single tribe. In theory, tribes were presided over by a chief or sheikh, but the presence and the authority of the sheikh has declined in recent years. One DOM father in our research, one of the fathers of the DOM community, he explained each family, this is literally what he said, like word by word, each family is responsible for itself. The father is responsible for the family. If a daughter gets married, her husband is responsible for her body, but her father is responsible for her blood. When asked about the DOM governance structure, the most common answer that we got is that each family fends for itself. In practice, this translates into the most senior man in the family bearing the authority over the family and relations with other families. Within a DOM community, the same men then assume the role of decision makers and take part in the diwan. Diwan is like a meeting that they do, usually the men, and then they take decisions during this meetings, this diwan. Despite the presence of informal governance structures, levels of social cohesion in DOM communities vary significantly. One factor that affects social cohesion is the location and urban or rural character of a gathering. For example, larger gatherings in urban settings tend to be characterized by a lack of central internal governance structure due to the existence of multiple and varying social units like families, tribes, and other ethnic, national, or religious groups. These communities tend to be more fragmented, while families relying less on neighbors for support. In contrast, smaller rural and more isolated communities are often composed of a single family, which increases community cohesion. Because of the discrimination that the DOM as an ethnic minority group face, their social networks and sources of support are largely confined within their own communities. However, because level of social cohesion are impacted by geography and vary from one DOM community to another, the extent to which such networks are effective in providing support to DOM adults and children varies from site to site. So we have seen like a lot of different ways. Now, regarding access to services, it was widely reported that DOM presently access more services than in previous generations. Such access, however, hinges on citizenship. Those DOM that have Lebanese nationality are increasingly able to access subsidized public services, while those without are still not able. The acquisition of Lebanese nationality has significantly affected the DOM way of life. They have exchanged their traditional itinerant lifestyle in favor of sedentarization, which means like they were they exchanged their lifestyle of nomad and they are more like now fixed in one place. Meanwhile, having Lebanese nationality has had a positive impact on the DOM's ability to access government services, which is particularly visible when comparing the lives of the younger generation, those born after 1994, because 1994 there was the census in Lebanon where Lebanese nationality was granted to a large number of people who were residing on the Lebanese soil. So to those of their parents. So we see a big difference between the younger generation, which are born after 1994, comparing to those of their parents and grandparents regarding service access. Regarding education, in many DOM communities, there's a clear generation gap with respect to education, whereby those children born after the passing of the 1994 nationality law are the first group to access formal education in their communities. Overall, school attendance rates amongst the DOM are staggeringly low. Only 77% of the population surveyed, age 4 and above, reported never having attended school. So 77% have reported they have never been to school, compared to between 9 to 10.3% of the Lebanese population. It is notable that within the entire sample, so we had 1,110 individuals who were interviewed, this was the sample, not a single person was reported as having enrolled in university. One of the DOM men said, 10 years ago, our family used to be afraid of enrolling children in school. We were afraid we would be arrested or be refused because people think we are afraid of science. Now we are trying to enroll our children in school, although there are difficulties. We would like to improve our situation to not be considered as nawar, in quotations. This is a testimony that one DOM man gave. Regarding healthcare, respondents also reported that Lebanese nationality has enabled the DOM to access public health services. Almost two-thirds, 63.6% of household surveys found that DOM go to government hospitals, while 27.2% seek treatment at public clinics and 13% at private doctors. During the focus group discussions that we held, DOM women and men reported that birthing in DOM communities mostly occur either with specialized midwives at homes, at their homes, or in government hospitals. Regarding income-generating activities, traditionally, the DOM have engaged in types of work that benefit their itinerant lifestyles, such as entertainers, craftsmen, etc., informal dentists. Today, some of the more traditional types of work, such as making wooden sieves, drums, and rabab, seem to be in decline, while others are still practiced. Meanwhile, community members often spoke about how working as singers and dancers during Lebanese wedding parties, which we call zaffe, was popular amongst adolescent boys and young men. Similarly, cases of DOM adolescent girls working as dancers were often mentioned. As the DOM in Lebanon ceased to engage in more traditional types of work in favor of employment in the contemporary economic arena, low rates of education amongst the DOM create a lack of competitive advantage needed to succeed in the labor market. So 56% of DOM respondents over the age of 14 are working. Of those DOM who are working, the majority are engaged in unskilled labor, such as in agriculture, selling produce or household items, and casual labor. Regarding women's work, 1/4 of the women covered by the survey, so 25%, indicated that they were involved in some sort of income-generating activity. The most frequent form of work amongst women was cleaning, with 14% of women in the sample engaged in this type of work. Other forms of work reported by women were begging, fruit picking, and peddling goods. Even though the overall number of women working is low, it is considerably high in the context of Arab societies, in which men are traditionally the breadwinners. One stakeholder reported that DOM women's involvement in income-generating activities was often a source of conflict between couples because the man's authority and pride as a provider were compromised. One particularly sensitive area of women's income generation is their involvement in sex work. It was common for stakeholders to report that DOM women, so stakeholders were telling us that DOM women were known for working as prostitutes. Unsurprisingly, due to the hidden and taboo nature of the subject, no DOM community members reported they were involved in sex work. Researchers, however, through field-based observations, are led to suspect that some DOM women are involved in sex work. Yet it is important to draw a line between, on one hand, acknowledging that DOM women are involved in sex work, and on the other hand, resorting to the negative stereotypes that claim that all DOM women are prostitutes, or they are culturally predisposed to this work. This research was unable to determine the specific reason why Dom women become involved in sex work. These reasons are doubtlessly linked to factors that push women of any ethnic, cultural, and national background to become involved in such work: poverty, marginalization, discrimination, to name a few. Therefore, this research makes reference to Dom women in sex work alongside an acknowledgement that these women face extremely precarious economic and social conditions that render them particularly vulnerable to involvement in this work. Regarding protection risks and need of Dom children, first, extreme poverty. Of course, this is the first issue that comes up, which is extreme poverty. So we know that Dom communities are living in extreme poverty. The second one is lack of legal basis for residence, which means many Dom children and adults are who participated in the focus group discussions. They spoke about a fear of being thrown off the land they were currently living on. Data collected during the surveys indicated that over 2/3 of the sample were living on land owned by other people, mostly third parties or the state or municipality, often illegally. The vast majority of respondents, so 81% of the respondents, reported they did not pay rent. Another important issue, which is really concerning, is early marriage and parenthood. So we know in Dom communities also this is really widespread. We have social marginalization and discrimination, high incidence of violence and neglect amongst the Dom children, limited access to safe play spaces. So they don't have really any safe spaces to play. Low education attainment, as we have already said, the level of education is very low, the people who access education or schools. Inadequate water and sanitation infrastructure, also they don't have access to water and sanitation infrastructure. And then absence of official identification documents in some cases. As mentioned, in some cases, they were naturalized, so they have the Lebanese nationality, but it doesn't represent all of the Dom communities in Lebanon. So we still have a lot of people who suffer from lack of official identification documents. And then, as mentioned, there's the lack of legal basis for residence. So they are actually residing on lands that don't belong to them, or they don't pay rent. So they are at risk of being evicted. Health concerns. Also, there's a lot of health concerns within the Dom communities. And also we have seen that a lot of the children, they are subject to dangerous and exploitative forms of child labor. We have children in conflict with the law. As mentioned earlier, we have the girls' involvement in or at risk of becoming involved in commercial sexual exploitation. And finally, we have the internal and cross-border trafficking of girls for the purposes of dancing and sexual exploitation. Finally, I want also to mention the recommendations that the research put forward. So after having this research, there are recommendations that came out. I want to mention the recommendations as well. So the first one was to advocate for recognition of the Dom as an ethnic minority group in Lebanon and the right of Dom children to enjoy their own culture and identity. Second, afford Dom families the necessary protection, assistance, and awareness so that they can fully assume their responsibilities within their communities and better provide for and protect their children, particularly with respect to hygiene, nutrition, and education. Thirdly, support all actors surrounding Dom communities, including governmental, non-governmental, and community-based groups, in mobilizing sufficient resources in order to take proactive roles in promoting the rights of Dom children, particularly with respect to health, education, and protection. Fourthly, combat the discrimination and intolerance expressed towards the Dom by sensitizing stakeholders about the misconceptions surrounding the Dom in Lebanon and promoting an awareness of prejudice among service providers. Fifthly, lobby the media, government actors, local and international NGOs to ensure that the name used officially for Dom communities is the name by which they wish to be known. Sixth, advocate for the decriminalization of children's street work and begging. Seventh, encourage the development of safe places for Dom children to play. 8, promote the organization of community harmonization activities with DOM and non-DOM that promote mutual acceptance. And finally, the 9th recommendation is to conduct further research about DOM children involved in prostitution and dancing, particularly those vulnerable to cross-border trafficking for such purposes. Thank you very much.
Thank you very much, Lala. Catherine, if we move over to you next, would you like me to share your video?
You need to put the video.
Okay, bear with me one moment.
كيف تسوي لما تجيك مزي يعني رقمية كمان يا موضوع كلمة ضوم أو نمط مو بخيري تيجا كم مثلا إذا جا كم يا أمام من العرب شلون رقمية كم من أمازون مو شايفين إذا كان في دو بياندي ويشور بينظروا لك بسبب دكتور مو بخيري يعني ما تكمل كمان ما يسكب كمية أنت صجع من دي مطلوب مشتم يعني دوما كشتم هذا لأنه وسبين دي بارا يعني مو دول عربية بيحترموا الآخرين حسن دي تانية ما إنه هو مثلا بشر أما بارا تكيجاتا لا بالعكس أشتي تمتشي كم كان عربيين يعني أشتي تمتشي بس أحسن إذا كم تكواكا يعني وجانو كيجانا زيو صفوري منجور إنه أحسن قال تدوم مشتوري لأنه إذا بعدين جامدين دوم مشتوري يمكن فجأة بيتنان لو خجل كندوي روم خانق رمان إيكا كجاي أم كجاشتو في جا أطو إيكا مريض أمو أمامو لبنانيين تيجا كان بدوم.
Sorry, everybody. Could you just make sure you're muted, please?
وشلون بس أعطوه لبناني يعني مشهور أغاك لبناني وأعطوه لبناني واللي قال كاري أبور أعطوه دوم شو أعطوه دوم ستوري لأني أنا ربي روم بخير يعني أعطوه لي باسور تربايات باسور أول ما بلش كرم كم إيه تنتا قالوا بنكا كي تسحبكم كان قرضة لما ننقردوهم كرين كافين وكل شيء ننقردوهم نوافق كرين معفيرة شي لأنه تضوم مشتر أول شيء وشكلوري هاني دومي يعني نوافق كرين دمدين دربيرين بيشور إيه والله اشتردوهم يعني دايا أضم مزعولهم اشتردوهم قاكلهم ثم قالكم مديرة سما شكلهم ما يغرك منظرهم يعني مين منظري ربينا عندي مين شكليرة يعني مو كل يوم كأنه قلت هاني طاقة موتور دي جرافيت تويت كتر فيها تبخيزي يوم بينا عرفتو مين اللي بيناتي أمين بيناني أمين سناني قالت بخير إني بياني وجاني نساني يعني بعدين ندخل الجمعية اللي كم واشياء مديرهم قالت رواشية وفيها وتندم بعدين موافقة المعفرة وتندم دوم استينا مين يعني مثل أي يعني أمتي يعني والله أمين بشندي بتوم أوقات يريد هندكي وأوقات بشندي إنه يعني أميتي يعني محل إنه ثابت مخلق رمضانيته ويا رمضان كلهم فايم بعدين جينا يرين تلبنا اللي كم كان دي دوم كم كان دي ربابي ما كواما كم كان دي ربابي كان دي دولين كان دي أكثر شيء لما يعني جرمي أحركي اللي كان دي دانتين اللي كان دي أصلا دي زميريتا اللي نتشندي لا ضم لأنه كيتا ماجو مزروطة يعني جاجنكي منجومة غير إنه غير شيء ديارو بدوم السور يعني قد ما غيرته وقد ما لكاجع ما عم يدوم فما لجي كمي إنه إذا دوم السومي نحاس كان دي أوقات لما ما قال كان يبغى سجاد إنسا في كم أفصل كان دي وتم يعني كان منسوم ولا كان شاغين ومن بيرامي وديا
Sorry, bear with me. I'll just see if I can.
We need to stop the video.
Do you want me to
No.
skip through to the Tahaddi logo
No,
again?
I did no. Leave the Tahaddi for just a while. It's
Okay.
okay. Yeah. Or remove everything as you
Okay.
like.
Over to you.
And we filmed this last week, and we thought it would be good to start this webinar with these two Dom women and give them a chance to share their stories in Domari. This is their endangered language that very few of them speak fluently in Lebanon. So it was both remarkable and sad at the same time that one of them chose not to show her face because she was afraid to be recognized at her workplace and possibly fired for identifying as Dom. Shireen has been part of the Tahaddi maintenance team for 15 years with her 6 boys attending our center. Laila is the mother of 3 current students, one of whom was top of his class this year. They both come from different Dom tribes, and we know it from their family names. In this video, they share their thoughts, their stories, but there are other realities about Dom people. Some are attending or attended university. I know some of them personally. Some work and do very well, while a lot of others, it is true, face challenges due to their origins, their status, and the struggles of intergenerational poverty. I will share my screen now. Can you see it?
Yes,
Can you
that's
see
perfect. Yeah.
Okay, okay. So I want to give you a bit of context about Tahaddi. Between the Shatila camp located on the Gbairi municipality and the sports city in Beirut, Madini Riyadiyeh, there are several areas of extreme poverty. And when we started visiting in Hayr Gharbi in the 90s, Hayr Gharbi is one of these very poor neighborhoods. The families there that we absolutely did not know were Dom told us they had very difficult access to health and education. The other co-founder, a French doctor now back in France, and myself, with my background in education, naturally we offered the support we felt we could best provide, mainly in health care and education. So we started by renting 2 rooms in the area, examining and treating people on a mattress on the floor. And for education, we asked friends to help us cover school fees for the children to attend formal education. But we soon realized that their deprived educational background made it almost impossible for them to succeed. You can imagine that these children, and you see the picture, where they live, they have no toys, they have never seen a book, never held a pencil, didn't know basic concepts like colors, letters, or numbers. They couldn't keep up, of course, with the bilingual grade 1 formal program, which requires reading and writing in 2 languages, especially since preschool till now is not compulsory in public schools. So in addition to paying fees for enrollment in public schools, we also decided to organize, back in the 90s, literacy classes for 30 out-of-school children aged 8 to 10 who were too old to enter formal education. Our education center, now you can see it on the right, serves over 600 children across 6 different programs, and I think a well-equipped facility. Before 2012, almost all our students were from Dom origins. And when the first Syrian children came knocking at our door, asking to go to school, this is our all Dom students who stayed after school to help teach them. As the center became too small, we built the second floor and later expanded again. Today, our center welcomes 60% of displaced Syrian children and 40% of Dom children. And as more children, Syrian children joined, we had to make a special effort to include Dom children. Syrian families were more vocal about their educational needs because they were used to have access to it in Syria and had this, but unfortunately they had the same prejudices about the Dom that also are present in Syria. Dom families here used to being and feeling excluded, starting to fall behind in the registration queue. Some might actually have stopped coming to the center if we hadn't visited them to encourage enrollment, staying true to our mission of leaving no one behind and prioritizing Dom children. So Tahaddi is one of the few education centers where Syrian and Lebanese children and adults learn, play, talk, debate, and solve conflicts together. You might recognize the Dom mother by the fact that she is not veiled, but some Dom women are veiled. We talk about the importance of going to school before accessing formal education, and that's why we began in 2017 an ECE Early Childhood Education program for 3 to 5 year olds. This program helps them develop vocabulary fluency and foundational skills in numeracy, reading, and writing. Our social worker then helps the families enroll their children in formal education, and they can join our homework support program. Unfortunately, more than once, when the social worker entered public school premises with Dom families, she heard derogatory comments because of the color of their skin, their appearance, and the school administration prejudices towards them. To the right of the picture, you see Mahmoud. He came to our center 15 years ago when he was already 10 years old and had never attended school. But he grew up, he got married, and when his daughter turned 3 years old last year, he came to enroll her in early childhood education program, aware that if he would give her this opportunity to enroll in public school at age 6, she would have better chance of continuing her education. In 2019, Tahaddi asked a consultant to lead a community assessment, and through a participatory exercise with 30 diverse community members, Dom or not Dom, gathered together, they had to answer a question. And the question was, what is well-being for you? And the community surprised us by putting as a top priority in front of education and health, having an ID or legal papers. And this was, of course, linked to employment and how they would feel about themselves. With funding from the Australian government and based on the community's expressed needs, Tahaddi started a legal program. And really, this initiative has helped hundreds of individuals obtain birth and marriage registrations, secured legal documents, and it has also helped preventing statelessness. Here we have the case of a Lebanese father and with a stateless mother. And because of the lack of knowledge of the law, they thought they could not register their marriage. As a result, the 3 children are now stateless till now. And solving this requires a lawyer, DNA tests, and several steps, including going to court, which are financially impossible for the family. And without Tahaddi's assistance and referrals to partner organizations, these children would remain stateless, passing the status to future generations. And now that she began the process, we have very good hope that sooner or later, she and her children would all get the Lebanese nationality. So despite the challenges in finding decent work, Dom youth really show incredible courage and creativity. Yasser inflates balloons daily to sell on the streets and actually considers it as a freelance work, preferring it to a more formal employment. We have more freedom, he told us. Karim, he handcrafts Ramadan drums from cardboard and goat skin, drying them in the sun before assembling it together. In 2021, in a survey of 61 youth in Hay El Garbi, it clearly came out that Lebanese felt discriminated against in employment, education, and healthcare, with nearly 68% experiencing discrimination at work. A third of Lebanese surveyed admitted they would sometimes hide the fact that they were Dom with non-Dom, as we heard it in the video. And no wonder why some youth prefer to do this freelance job instead of facing discrimination in a more formal employment environment. But some Dom youth participants of the Tahaddi Education Center have opted for an in-house trainings that hold promises for more stable income in the future. But Dom youth are triply disadvantaged in the labor market. 1, for being Dom, 2, for growing up in multi-dimensional poverty, and 3, for being a young person seeking decent work opportunities in Lebanon. If they are stateless, they are even more discriminated against and exploited. Just a word about Hassan in the middle of the slide. He's one of our former students who studied carpentry at Dar al-Shabab 8 years ago. In 2020, during COVID crisis, we called on him and his friend to make 600 floor tables so that our students could study online more comfortably than bent over the floor of their room. Hassan stood out for his hard and good work, and we started to ask him to make furniture for the center or for the community. Today, he has been hired by Tahaddi as a core instructor for the young trainees alongside the main instructor. Many Dom families own their homes, but in squatted land, as we heard from Lala before. But the rooms are often in poor and dangerous conditions, lacking proper windows and essential needs. So a Dom family of 6 lives in this single small room with only a door for ventilation, minimal furniture, extreme temperatures, and inadequate kitchen and toilet facilities. They have an access to water, but no sink, as you can see. In this house, 2 families share a rented space to save costs, but they lack running water and must carry it up 3 floors. Another essential need of the population in Hay El Garbi and its neighborhoods is access to healthcare, as you heard it, and this is how we began also at Tahaddi with these two things, yani health and education. The Tahaddi Health Center offers free health services to families of all nationalities, and this includes consultations, medications, vaccinations, and partial coverage for surgeries and hospitalizations. At the request of the often very young mothers, the nurse organizes throughout the year several educational sessions on maternal and child health, breastfeeding, baby care, and birth control. To conclude, I would like to quote these lines from the Asayran 2024 article. One young Dom referred to the black swan metaphor, arguing that perhaps few Doms were highly educated, but if only one obtained a university degree, the belief that all Doms were uneducated was no longer valid. And several interviewees in her article quoted the Levantine proverb, "We are all children of nine months," to highlight the common humanity we all share despite our diverse origins. The references that I used and I quoted sometimes are on this last slide. Thank you.
Thank you very much, Catherine. And now if I hand over to Dr. Ignatios from Lebanese Developers.
Yeah, hello. Can you hear me?
Yes, clearly.
Okay, so I may have some cut in electricity, so you should bear a little bit with me. So if I disappear one moment, I would come back after some minutes. Okay, so this is something usual here for us in Lebanon. So yeah, as you mentioned, my name is Roy AbiJaoude. I'm the president of the Lebanese Developers. It's a Lebanese NGO registered since 2008. The LD executed several environmental projects in various regions of Lebanon. One of them is opening an environmental trail for hikers on Nahr al-Jawz River in Batroun that I invite all of you to visit. The domain of LD activities include income generation, agriculture extension training, and nutrition, food utilization, women development, vocation training, rural development. So there is a variety of all those. I will try to share my screen a little bit to show you some of the pictures that we had. Yeah, so you can see my screen now.
I think it's in the process of sharing.
Sorry, what do you see?
We can't see anything yet, but it says that you've... now they are there. We can see it now.
Okay, so now you see the women down that you work with.
Yes, yeah.
Okay, great. So the LD works on integrating the gender perspectives and involving women in the Lebanese labor market through its Women Livelihood Center that is located in Akkar. It is the first women livelihood center that was created in Lebanon. So we try to give them opportunities to integrate the labor market through the proposed trainings and
Oralarda çalışıyorlar. Dolayısıyla
potential
demek
vacancies.
istediğim şu. Alttan
Sorry, everybody. Could you just make sure you're muted, please?
So LD has been working with the Dom population, also known as gypsies, and mainly women in support for their actual situation since 2017 in collaboration with several international NGOs like the Turkish Kirkaya Culture and the GMED, the BMED, and lately with the MRG, Minority Rights Group. LD has also advocated for their cause at the European Parliament in December 2018, where I was invited to participate in a workshop on Roma people and where we informed them about the DOMs in Lebanon and their situation. So the DOM community, as most of the participants said, it is one of the marginalized minority groups in Lebanon. The DOM community in Lebanon generally spreads to the whole of Lebanon. They live mainly in northern Lebanon, Tripoli, Beirut, Saida, Bekaa Valley. So you can find them everywhere in Lebanon. After the civil war in Syria, the Syrian DOM community also moved across Lebanon. Thus, the Syrian DOM community, with the status of asylum seekers or refugees, are also living with other DOM community settlements or informal camps in northern Lebanon and other parts of the country. So the DOM community identities, DOM community includes the refugee DOM society. They face discrimination because of their lifestyle and their identities across Lebanon. As you can see in the photos, the way they dress and everything, it is very obvious, so people recognize them directly. So they can't access basic services and their fundamental rights in society to where they belong to. Specifically, if we speak here, being a woman DOM in the DOM community brings more challenges than being a man in the DOM community. So DOM women face additional burden of racism as well as gender discrimination, which pushes them to the margins of their own societies. Dom communities generally preserve traditional family roles, so the family relations are hierarchical, with men having a privileged position while Dom women have an inferiority status. Although Dom women engage in family income generating activities, Dom men generally have the privilege of absolute control of the financial resources, activities, and money. We have seen this several times in our trainings, where whenever women or the woman would get some money from the trainings that she was attending, her husband or the man would take them directly and have access to the money, and won't let her use it for herself. So Dom women also cannot receive equal pay as Dom men in house incoming activities. Dom women face barriers while accessing fair and decent jobs in the market. Additionally, Dom women also face risk of becoming victims of forced prostitutions, as mentioned, trafficking, abuse, violence, early marriage, and pregnancies. Reports and case studies on gender roles and women problems in the Dom society are very under-researched. Lebanese developers conducted a pilot research voluntary to increase concern about protection risks, barriers, accessing fair and decent jobs, and main needs of Dom women. So we'll go a little bit through this or the findings of this study that we did, where all surveyed Dom women and adults and girls indicated a difficulty to access essential services. The urgent needs for electricity, clothing, sanitary products, legal assistance, and protective services were mainly requested within informal tented settlements. Insufficient education and legal rights pose limitation to Dom women and men when search for decent work employment. So decent work conditions are very, very hard to get. Dom women experience feelings of insecurity, both within and outside informal tented settlements. The awareness of Dom women and adolescent girls regarding various types of gender-based violence and other forms of aggression is lacking. Within the informal tented settlements of Dom community, there's a lack of spaces specifically designed to care for women's needs. The scarcity of job opportunities further challenges Dom women and men alike, and Dom women and adolescent girls face physical and sexual harassment inside and outside the camp premises. So if we want to discuss a little bit about accessing of livelihood programs and dignified jobs in Akkar, we see that this poses significant challenges for the Dom community, particularly Dom women. These challenges stem from various socioeconomic and structural factors. Well, the first one, the social stigma and discrimination. Dom communities often face deep-rooted stigma and discrimination, which marginalizes them and limits their access to education, employment, opportunities, and public services. So Dom women in particular, they may encounter discrimination due to their gender and ethnic background. We have a lack of education and skills. Many Dom individuals, including women, have limited access to formal education and vocational training. So this lack of educational opportunities restricts their ability to acquire marketable skills that are in demand in the job market. Third one, it can be the limited employment opportunities. So the Akkar district, like many rural areas, may have some job market with few opportunities for formal employment. Dom communities often rely on informal and precarious forms of work, such as seasonal labor, which offer low wages and minimal job security. And this is why we can see lots of women who are not paid during the day or during several days, and even though they come back to the same place to work, even though they may not be paid. So they don't have lots of opportunities there. They also have language and cultural barriers. So the Dom communities face challenges related to language barriers, particularly if they speak a dialect that differs from the dominant language used in formal employment settings. So, and it was mentioned before, so they can recognize them directly from the way they speak. So the cultural differences and lack of cultural sensitivity among employers can also hinder their integration into the workforce. And this is why we also work with the employers to minimize those problems and maybe allow DOMs or women DOMs to work. They have access to financial resources. Many DOM families live in poverty and lack access to financial resources, such as credits and savings, which are necessary for starting small businesses or investing in vocational training programs that could improve their economic prospects. We have also limited support services, so there may be inadequate support services available to assist DOM women in overcoming barriers to employment, such as childcare facilities, transportation barriers, and access to healthcare services, which are essential for workforce participation. The last one is the legal and policy constraints. So discriminatory laws and policies may further impede the ability of DOM women to access employment and livelihood programs. Lack of legal protections against discrimination based on ethnicity or gender can also exacerbate their exclusion from formal economic opportunities. So addressing these challenges requires a multidimensional approach that involves targeted interventions, including policy reforms to promote non-discriminatory practices, provision of vocational training and educational opportunities tailored to the needs of DOM women, creation of supportive employment environments and initiatives to raise awareness and combat stereotypes within the society. So by empowering DOM women economically and socially, it is possible to enhance their livelihood prospects and promote their full participation in the Akkar district economy and society at large. So if we can give some recommendations for humanitarian women rights organization, we can say that there are limited research and case studies on DOM society in Lebanon. Hence, more special studies and research could be conducted, such as gender norms, family roles, GBV, and child labor. There should be a mapping of the DOM community in Lebanon, which could be done, and multi-sectoral need assessment also should be done by humanitarian organizations. Their main needs, such as accessing electricity and clean water, could be met by relevant stakeholders. As you know, the DOM community is a closed community, so it is very difficult to enter their camps unless they trust you. And luckily, our staff are very well trusted by DOM women, and we can access the DOM camps in the north. Some more recommendations. The current women's empowerment projects and programs could also include DOM women in their programs. Local organizations and relevant stakeholders could provide legal and protection assistance to DOM society. International humanitarian organizations should cooperate and collaborate with local organizations that have connections and relationships with DOM society and implement their activities. As I told you, it's a way to enter the DOM camps. Otherwise, it is or it is impossible for international NGOs to support the DOM community. So human rights organizations could extend their evidence-based advocacy activities, including DOM refugee community also. Women and adolescent girls are facing regularly harassment or forced prostitution. So therefore, MHPSS and PSS activities should be provided to DOM women and adolescent girls. Trauma studies of universities should produce case studies on DOM women and adolescent girls and traumas. Thus, the visibility of those communities could be extended. Gender studies also and women rights organizations should include DOM women and adolescent girls in their research, as well as university institutions. And last, special livelihood activities and strategies for DOM women and men could be implemented to access decent and fair job opportunities in our region. So we tend for decent work for those people. We have problems in having decent work jobs for Lebanese. So what about the DOM community? It is very hard to get those decent work conditions. So these working conditions are very hard on the DOM society, and those recommendations, I think, should be taken by local and international NGOs who want to support the DOM community and include them in their projects. Thank you.
Thank you, Dr. Ignatios. If I could just ask 2 or 3 questions to the panel, and then we'll open up to questions and answers from any audience members as well. First of all, we've heard a lot about the structural and social obstacles that face many DOM in Lebanon. I wonder if anybody has encountered or come across any instances of organized resistance to that, or DOM-led advocacy or other initiatives which aim to counter that in Lebanon. Whoever would like to answer, please unmute yourselves and go ahead.
Could you repeat your question, please?
Could you repeat
Sure.
it?
Are there any examples or instances that you've come across of DOM-led advocacy or activism initiatives, or any kind of organized resistance to the marginalization and the social and structural obstacles that DOM experience in Lebanon? And I should probably add, if there aren't any examples, why do you think that is?
I haven't heard about DOM-led initiatives, but maybe I'm wrong, and maybe there are. Mainly because they think they cannot have a voice, and maybe also because they have internalized these prejudices and the fact that they do not have a voice. Also, we have experienced in our education center young preteens and teens who do have a voice and do defend their rights.
Sorry, if I may also add, like, before leaving, I totally agree with Catherine, because like we haven't heard as well. And actually, when we finished our research and we wanted to launch it, we were launching it like with the minister there, and like there was this official presence. And then we invited the DOM, like a group of DOM communities, to come and attend the launching, because like it's their, it's their cause, it's their struggle, it's their advocacy, if you want. And it was so surprising for them that we were inviting them to be there. For example, it was in a fancy hotel and stuff, but they were so happy actually. And we had a bus that brought a big number, like a group of DOM who came to this event. It was really, really nice to have them there. It was a bit surprising for the other people who were there, because like they're not used to having the DOM or like these communities attending these events. But I think this should be more and more encouraged. I mean, this is where we need to start making the change, like get them more involved, get them more, and give them voices more, because until now we're not seeing that. Like we don't see their voices heard. I think first, they're not used to it. Second, they don't have any confidence that they can make a change or they can have impact. And of course, like they're marginalized, of course, like so they need to be empowered more in this regard, I think. Thank you.
Yeah, I can give you here an example. For instance, we in one of our projects, we were doing some awareness sessions for the fishermen, and the ones who were doing this awareness were dumb women. So we trained them, and we asked them to give those awareness sessions, and so the fishermen recognized them directly. So it took us long time to convince them to go outside of those camps and participate in the awareness. But the society is very harsh on them, and they recognize them, and they told them that you are DOMs and you cannot come and tell us what to do and inform us and give us awareness. So we tried to help them go outside of their societies and make them heard, or make some interventions, but they recognize them directly, and as I told, they were very, very harsh with them, and women were not happy with that. So women supported us in cleaning the beach in our car. We tried to support them to get outside of the camp, have some make them work with Lebanese women, as I told you, in cleaning the beach, for instance. But it's not always that easy to have, especially if we have any gathering. We're doing it. Usually they don't show up, especially if they are Lebanese invited. If you do it inside the camp, they will show up. But if you do it outside of the camp, unless you provide the buses for them and you insure them and you have a presence, or the most trusted persons in our organization, they are there with them. Otherwise, they won't dare to get outside the camp. So yeah, it's not easy to make them heard, or for them to have the gut to get outside of the camp and express themselves. It's not that easy.
And I think also whenever DOM youth or adults have succeeded and had gone to university, they had so much enough of discrimination, they will hide the fact that they were DOM, because just because of the fact they succeeded, they kind of graduated from this discrimination that they had experienced before. But Kayak Culture that I think are on the panel, or on they are present, I think they have been quite good in giving the DOM a real presence, an active presence in Turkey. So I don't know if they can talk or if they can manifest themselves, but we met them in Gaziantep some years ago, and I was impressed to see how they had succeeded in really putting forth the DOM voices and the DOM themselves.
Yeah, and they have supported us in one of our projects with DOM. So yeah, they're doing good work. Even the reports they do on DOMs in the region are very important. So maybe Kemal can intervene here.
Yeah, I was going to say, we have Kamal and Zahal here, so please do unmic yourselves and say whatever you feel needs to be heard.
Yeah, hello. Yeah, I am talking very short thing about our center. Kırkayak Kültür has a DOM research center. Now we are the last year we are a program. We are working for DOM community. We support DOM community for human rights side, and also we have a protection program. We support Syrian DOM community also in the Turkey. Before that we are work also in Jordan and Lebanon. Now, in our Dome Research Center, we have 2 programs. The one of protection program, we support our family about access to service and the systems of government. In our protection program, we are working with social workers. All days they are visited our family in the field, and we have education program. I think in Turkey it is unique program. We are working with government sites. We are working in our neighborhoods. We register our children to school. You know, in the Turkey also dropout is a big problem for our children. We support our children in the schools. We organize some workshop for teachers, managers of school on a discrimination, access to education systems. Yeah, we are working like a bridge between the community and education system. We are member of some commission, the government sides also. Yes, now our manager of this center, she is at Dome, Zuhal. She attend also this meeting, I know. Zuhal, she's from Diyarbakir, and she's Dome woman, and now she working for her community in our center. Yeah, for me, yeah, we have many work for advocacy and humanitarian sides, but briefly, it is our work. It is like that. Thank you.
Thank you, Kamal. And I noticed that you said you work with the government in Turkey in some ways. I wonder if you could just explain that a little bit, and then I can pose the question to the panelists based in Lebanon. Is there any governmental support for Dom in Lebanon of the kind that Kamal may be about to tell us about that exists in Turkey?
Yeah, we have a protocol with education ministry. We started work inside the schools because of we are member of Roma strategy commissions in municipality and the local side, also for the government sides. Yeah, in our protocol, we are now have 4 schools in 5 neighborhoods. We are support our children inside the school because of they are pushed out by the teachers, by the other children and the other families. Yeah, we are our social workers working inside the schools, and they also visited our family when their children cannot access the school. We are registered our children. We prepare report. We are discuss with government about the problem of community, why they cannot access the education systems. Yeah, our work, education work like this.
Thank you, Kamal. So then over to, I think Lala might have left us now, but over to Catherine and Dr. Ignatios. Is there any kind of state level initiative or integrative working group or sort of policy oriented body of any kind that does any work with DOM in Lebanon?
As far as I know, no. There is nothing that has been geared towards the DOM in particular. Also, there is an effort to do more inclusion, especially of people with disabilities, but the dome haven't been mentioned so far, as far as I know.
And Dr. Ignatios, is there anything that you would like to add on that subject?
Yeah, not to my knowledge that there have been anything from the government side. All the interventions usually are from the NGOs. We are working on advocacy for the DOMs to get registered or to get any kind of papers so that they would have some rights inside this Lebanese government. But we're still on the first steps, and we'll see what will happen afterwards. Thank you.
Hello, what has been done at the education level is that now children without stateless children have the right to register in public school if some paperwork is done, which again they couldn't do if a social worker would not guide them through this. But there was a time where stateless children could not access education. Now they can. And DOM children who are Lebanese, they are Lebanese, so they should access education very easily. But as I mentioned, the prejudices that are attached to them, and if they are recognized as being DOM because of their appearance, because they are sometimes have a browner tone of skin, then they have a problem.
Okay, and I think it's quite an entrenched approach across both Europe and Iraq, and it sounds like Lebanon as well, that the onus is often put by society and the government. The onus is often put on DOM themselves to integrate, but the focus is never, it seems, switched to focus on anti-discrimination and promoting integration and acceptance amongst non-DOM. Have you seen any examples of kind of public awareness campaigns that aim to combat discrimination against DOM, either from the state level or from civil society, or specific NGOs other than yourselves? I'm not sure.
I guess the answer is no.
So, final question before I hand over to anybody else in the audience who would like to ask questions, I guess, is in your sort of ideal world, or your sort of perfect imagined Lebanon, what do you think needs to change in order for DOM to be able to access resources and opportunities equally to non-DOM in Lebanon?
This is not easy. It's not an easy question. So we gave, or in my presentation, I gave some recommendations for NGOs what to do in their interventions. But working with them is not easy, especially as I told you, it's a close community. So you should have their trust to be able to enter their society and work with them. So I guess we started the work by doing the social cohesion between DOMs and women DOM and Lebanese women. But again, it's not easy. Discrimination is always there. And this makes the DOM women or population afraid of doing this interventions or participate in similar gatherings. So the awareness, I think that there should be awareness within the Lebanese population and with the DOMs. So with the Lebanese population, we should be involving or telling them that those are people like us, and there's no difference between them. And I guess that gatherings like within the municipalities or with key informed persons is something that is feasible and lets this social cohesion between the two societies be more effective. Thank you.
Thank you. And Catherine, did you have anything to add to that, or?
Ria Seiran has written a policy brief in 2021, and she has made several recommendations. One is to improve employment opportunities for DOM youth who are excluded from the labor market. Another one is access to basic legal rights. Stateless DOM youth who were born in Lebanon and who don't have a second nationality have the right to citizenship as per Lebanese nationality law. So we need to raise awareness and advocate for this. Of course, raising awareness is key, and I think our NGO, civil society actors have a very important role to play in promoting education, preventing statelessness, promoting health. She also recommended that the social protection and social safety net for the DOM. They should have the same safety net and social protection as the others, even if they are stateless. The multidimensional poverty in which a lot of DOM Lebanese households live is something that is not normal. And so if the Lebanese government prioritize a social protection net, then this extreme poverty should slowly improve, and they should not depend on the NGOs charity to get over extreme poverty. So of course the state is absent in Lebanon. If it were present, then statelessness would be limited. They would be helped in getting registration and registering the birth or marriage. They would have maybe health care, old age pension, unemployment insurance, disability benefits, but it's not here for even Lebanese citizens. I know a lot of DOM Lebanese citizens of, I need to say, maybe 20–25% are stateless. So, yeah.
Thank you very much. And is there anything else that either yourself, Catherine, or Dr. Ignatios would like to say that you think we haven't discussed so far?
One thing that the international organizations should be involving the DOM communities within their support or their projects, and usually they are ignoring them, especially the UN. Also, I don't know if there is a fear of dealing with them or what's the problem with that, but it's something very important and urgent to include the DOMs in regular projects where all the Syrian refugees, for instance, are attended. So, and here we should differentiate between the Lebanese DOMs and the Syrian DOMs. Syrian DOMs, they may be registered with the UN and get sometimes the support, whereas the Lebanese DOMs are more and more discriminated, and they're not getting any kind of support by any NGO.
Okay, and with that, if I open up, does anybody have any questions or comments? If you're not sort of totally comfortable speaking, just type them in the chat and I can read them out loud. Guys.
Hello.
Oh, hello.
I'm Danny Daham. I'm the medical director of the Tahaddi Health Center. I'm with Catherine. I just wanted to say to note about the like any DOM-led advocacy groups. I think in the context of Lebanon, it's very difficult. First, generally, like these people have internalized centuries of condescendence and exclusion from the other community. And in Lebanon, we have a very polarized society where each group is very cautious or even hateful toward other groups that form Lebanon, usually along sectarian lines. If I was an additional group, I would be very wary to jump into that. The possibilities of gaining benefits is very low. What I see around me is the main, the DOM have been, the efforts of emancipation is mainly personal, about gaining financial, economic emancipation. We see many financially better off DOM families who are able to help their families, their surroundings. Maybe they do not have university degrees, but they can offer their relatives big weddings or help them when they're in a bad place. So I think it's good to consider the down-top approach more than the top-down approach. Teaching or raising awareness among all the Lebanese about everybody being equal. Lebanese have real issues among each other as groups, so it will not be easy to introduce another equal group. Not that it's wrong, but it's easier for interventions to be on DOM people gaining more independence and emancipation financially and economically through education, through work, through the basic, these basic intervention, then working on stuff like gender equality. These things are not bad per se, but how efficient they will be compared to a family being freer to move and to maneuver in society, especially as Catherine said, most of them have the Lebanese nationality. So this is my impression while working for a while among the DOM society. They are really, they want to work. They try to do many things. Giving them more opportunities will work on all the other levels, including gender violence or other stuff. Thank you.
And I think what we need to do is to combat stigma. It's very important that us as civil society organization, we increase knowledge and public awareness of DOM culture, language, and that's why we did this video. We wanted to do a video where they would speak Domari. And you heard how Shireen Fadia said, and when she wanted a loan, and she was refused the loan, she boldly told the director of the bank that it's not because he has a tie and is behind a desk in a nice place that he's better than her, and she got the loan. So I think it's very important that we continue to fight a stigma and empower DOM children, DOM youth through education. Through work opportunities, through a lot of different actions that we can do to give them back self-confidence an awareness of their talents, and they are numerous. So they are proud, or they can choose to say they are Dom or not, and have equal opportunities as others.
Yeah, I agree. Thank you, Catherine. It's definitely, as Danny said, like a tremendous struggle, and will be a tremendous struggle countering that stigma and encouraging people not to discriminate. But it's so important, I think. And does anybody else have any questions or comments? Okay, I'll take that as a no. And thank you so much to everybody for your participation, to Catherine and Dr. Ignatios and Lala, who has now left, and to those of you who provided comments and insight and gave us something else to think about as well. I really appreciate it. This video will go up on YouTube probably next week sometime, but we'll let you know when it is up. We just want to keep it as a resource for anybody who's kind of trying to research DOM in the future, or look at sort of social cohesion or sort of peace building and development with a focus on Lebanon in the future as well. But yeah, thank you so much, everybody, and we'll stay in touch, definitely.
Thank you for organizing it and giving us the opportunity of presenting what we do with and for the DOM.
Oh, no problem, no problem. Anything we can do to help in the future, please do.